Okay, so this morning we continue to look into addiction and the impact that COVID-19 is having on people who are struggling with addiction. Let me cross over to Kampala, to you again, Bill. We are in the season of COVID-19. What does that mean for people who may be having this alcohol or other addiction challenges?
Sorry. Addiction is an obsession. It is an obsession. If we understand what an obsession is, I like comparing it to losing your keys. If you're in a hurry, you're late, and you lose your keys, you get into a panic. That is what happens, whatever you're addicted to, whether it's a behavior or it is a substance. When you need it, you are desperate for it. Now, during these times, it's a little bit difficult because, number one, the money is not accessible. And usually there were the enablers that would give the addict money to go and drink or use drugs or something of that nature. So they are limited. So during this season, they are downgrading more from what they used to use to lower grades of whatever it is, like the lady before mentioned, coming from whiskey and going down to all the liquors. We all do that. We all did that, especially if we're in addiction. Recovery during this time is very difficult because we cannot access the meetings that we go for. You know, there's Alcoholics Anonymous, already mentioned, and all these other anonymous meetings that are supposed to be happening. We need social contact. I also mentioned that it is not something you can sort out on your own. You need to get into a treatment center right now. To get into safe places, you will have to first go for a COVID-19 test. So there is a procedure. And, you know, because we are wondering, if we bring you into the treatment center, then are we going to first quarantine you? You know, there's all that. So it is a very difficult time. And with this obsession, people are desperate. Now, this is what the addict does. The addict uses their drug of choice or behavior of choice as their consolation. It becomes the solution. If you fail to access it and you become desperate, then you're capable of doing desperate things. And one of the things that I believe, that's me, is fueling domestic violence in the homes is a lack of access with the addition of fear, lack of access to your lifestyle. That are the majority of people were used to winding down every day with a drink. They are dependent on it to wind down their day.
And now they're at home
on alcohol. Yes. They were dependent on alcohol to kill the stress. You know, they'll say, I'm drinking because I'm stressed. Now, all that is not there. So they're going to put the stress somewhere. For those who are addicts, finding help is a difficult thing. People don't want to ask. People don't want to admit defeat. And then also, I think the biggest problem right now and before is that nobody thinks it's important enough to consult a professional on the subject of addiction. They believe they can handle it. Families believe they can handle their person. Others believe going to speak to a psychiatrist or to a counselor, counseling psychologist, to a psychologist, they believe it's a waste of money, or they believe that they'll be giving them something they can already do for themselves.
Bill, thank you for that. And when you mentioned downgrading, let me turn to you, Taib. COVID-19 is with us. We don't know for how long it will be. How is that complicating the whole issue of addiction, the season that we are in?
A lot of services, especially when we have the restriction of movement. There are people coming in from Kwale, coming in from Kilifi County, Mtwapa, coming to Mombasa. It has really restricted them to get into services. And we have seen the vulnerability of drug use, the issues of smoking, inhaling, injecting. It has affected the lungs, and this is where now the interdiction or the interaction between COVID and addiction comes in.
And so with the...
we need to...
You say that, you know, access to help is also affected, but what about access to the substances themselves?
Yeah, because of coming in and going out has been restricted, and now we have seen the borders also being manned well. We are also feeling the scarcity of the drug itself, the heroin, and also the Ministry of Health in terms of social distancing, and these people or people who use drugs at their community, they need to engage, meet together, and that is where now the risk that we want to manage, to be able to reach out to them, to make sure that they have hand washing buckets near them so that they can be able to follow the procedures of what the Ministry of Health has put in place.
Okay. Now, Anne mentioned about downgrading from high-class drinks down to changa. Bill mentioned that. Murang'a is actually a case in point. After the government closed down bars and other entertainment joints, addicts in Mathioya, Murang'a County, who cannot go for a day without a taste of alcohol, have now turned to sanitizers to satisfy their thirst. The administration is now warning residents against taking the free sanitizers being distributed by the government to fight COVID-19, saying the people concerned are risking their lives.
During this free hand sanitizer distribution exercise in Kireni town last weekend, residents got at least half a liter of the liquid in efforts to curb the spread of COVID-19. But some collected the liquid for another use, quenching a thirst.
Na hivyo mnasema de sanitizer ati inakunyagwa. Sisi tunakunywa. Na tunakunywa hiyo kibuyu tukiwa watatu.
Mnakunywa kwa nini?
Kwa sababu ina taste kama pombe. Kwa sababu pombe ilifungwa kwa kilabu. Sasa tunaonelea sasa tukunywe hiyo. The
sanitizer, they say, has a serenading effect.
Sasa wewe unalala mkiwa mzuri tu. Kama mtoto. Nikikosa hata asipati usingizi kwa sababu utaota madoto ingine. Sasa mimi natafutaka sanitizer mahali mimi nitapata.
This is hardly shocking for the residents who say alcohol abuse is rampant in the area.
Ni vibaya wasiitumie hivyo. Hii ni ya kusanitize. Na tunawaomba tu waitumie ipasavyo ndio wawe wakisaidika.
Si nzuri kwa sababu iko na a lot of chemicals, huwezi jua ya kukill germs, ya kukunywa.
Wasiseme hii sanitizer ni ya kunywa, ni ya kunawa mikono kwa ajili ya COVID-19.
Authorities are urging these individuals to be mindful of their health and use the sanitizers for the right purpose.
Na nashukuru chiefs na assistant chiefs wetu na police wetu kwa sababu wamechukua hatua kikamilifu. Sasa tuna uhakika ya kwamba ile tunapatiana itatumika vile inatakikana.
Na tunaomba wananchi wa Mathioya wasijaribu kukunywa sanitizers. Ni hatari hata kwa mwili ya mtu ama kwa maisha ya mtu. So wale ambao watapatikana watachukuliwa hatua ya kisheria.
Those drinking sanitizers claim it is bitter compared to the normal alcohol, but insist they will continue drinking it until when the bars will be opened. Martin Mora, NTV, Murang'a County.
Okay, bars aren't open yet, but there is hope. Now, recovering alcoholics in Mathioya constituency have reason to smile after they were rescued from consumption of sanitizers in place of alcohol. The youth have now been put in a group that will engage in agricultural activities to keep busy and earn a living. Their plight was first highlighted here on NTV by Martin Mora, as you saw, who now reports on the changing fortunes.
A fresh new start for these young men. After weeks of resorting to taking sanitizers to quench their thirst for the now hard to come by alcohol, they are ready to try something else, something more productive. But first they have to undergo medical tests to ensure that they have not been adversely affected by the sanitizers they have imbibed.
Sisi wale walikuwa wanakunywa sanitizer tumebadilika sasa.
Part of that reform process will include them learning new skills. And to set them off on this new journey, they received the seeds of their new venture. And now they will be part of a youth group spreading the gospel of an alcohol abuse-free society.
Tawaambia waachana na kunywa hiyo maneno ya sanitizer. Hata hiyo pombe ingine, hata kukifunguliwa hiyo vilabu, waachana na pombe. Tufanye kazi.
Charles Mwangi, a health practitioner, affirms the dangers of taking sanitizer.
We have taken blood samples, we'll take them to the lab, we test. Once the results are out, we will communicate to the relevant authority or to the concerned person.
The youth had been suffering from the withdrawal syndrome after years of alcoholism. Now they will have support as they try to beat the withdrawal symptoms that come with the journey to recovery.
I want to start a journey with them. I want to rehabilitate them. I want to make sure that I empower them so that in the next few years, these 5 young men here
will be a good example to those people who are actually swallowed into drunkenness and drug abuse.
Kenyans were also asked to continue observing the laid-down regulation by the government in effort to fight COVID-19.
The youths have vowed to stop taking sanitizers. Instead, they'll be taking milk when the craving for alcohol strikes. Martin Mora, NTV, Murang'a County.
Okay, a story of hope there in Murang'a. Now, Anne, if you were listening or watching that, can you give us a sense? You shared how you yourself had to downgrade when, during your dark days from high-class drinks down to changa, down to jet fuel. Can you give us a sense of why or how people become so desperate, like we saw in that case of Murang'a now resorting to sanitizers?
Actually, it gets to a point where now I became choiceless, because the moment the alcohol gets into your system now, it's the alcohol that was controlling my life, it's the alcohol that was making decisions for me. I was choiceless, actually. And that is why it comes with a lot of desperation, especially because of the withdrawals. I understand what these Murang'a people are going through. I come from Murang'a, and I know there's a big, big problem there. And I hope they have a structured program for that, because it's not just about a few days of treatment and then you leave them alone, because they'll need psychosocial support and also aftercare. Withdrawals can be pretty painful. There's a lot of discomfort in it. Dealing with it is not easy, and that is what actually drove me to drinking in the morning, because it comes with a lot of sweating, a lot of stomachache, diarrhea, vomiting, and all that. So it's a combination of very painful things, and then on top of that, emotionally, you're so devastated, low self-esteem, lack of self-worth. Alcoholics and drug addicts, or people with substance use disorders, are a misunderstood population. And that's why I agree with Taib when he said that we've been labeled prostitutes, especially when women drink. And that's why they will not come out and say, I need help, I'm an alcoholic. And that is what motivated me to actually go public, so that people can know women get addicted and they can actually get out of addiction. And there is hope. And recovery is possible.
And Anne, as you were saying earlier as well, you feel that the situation is really, the COVID-19 is not helping matters because of alcohol and people drinking at home.
No, it has actually gotten worse. It has gotten worse because people have turned their cars into bars, whereby they stop the car outside the bar. Then you'll find the bar attendant with the basket going to the car, take the empty bottles and go back to the bar. The bar is closed, the alcohol is available. So cars have turned into bars. So okay. There's nothing much that the COVID has done to reduce the drinking. If anything, people have more time to actually drink. And then there's this tendency of cross-addiction, whereby if you cannot be able to get the alcohol, then you cross-addict to something like Mira, because it's also a mood-altering substance which is legal. Okay. So there's a tendency of cross-addiction, which is very, very high.
Okay. And stay with that for a moment. I want to cross over the border to Tanzania, to our correspondent Tulanana Bohela. Good morning to you, Tulanana, first, and welcome to Your World.
Good morning.
Okay, Walter Mosije in NTV Uganda in Kampala. Good morning. Walter, can you hear me? Okay, let me come
Yes, I can hear you.
Oh, lovely. Let me start with you, Walter. First of all, just give us a quick update on the latest situation regarding COVID-19 in Uganda.
All right. So the president did address in the past 2 days, that is yesterday and Monday, and our 14 days had come to expiry. And what he did, of course, was to add another 14 days and another 21 days concurrently. Now, this he alerted the public that for the 14 days they will be trying to open up and letting loose of the lockdown. Public and private transport will be allowed, but of course public transport will have to, for example, the matatus or the taxis here, how we call them, will have to take half the number of the people that they normally take. If they take 14, then they'll have to take 7 people, and of course the matatu drivers have already announced an increase in prices when that officially starts. But all that will be pending the receiving of face masks. It's now mandatory here for you to be out in public with a face mask. If you don't have one, you're actually liable to being charged for not having a mask on while in public. But the government is going to, supply face masks to everybody here in Uganda who is above the age of 6, and that they say is going to be done in 2 weeks' time. So from today, the government is going to educate and also distribute these masks, and then that's when public and private transport can start, including opening up of general merchandise shops, but malls and arcades will remain closed. Now, the other thing that they are fast tracking is having testing centers opened up at most border districts, and of course public and private transport will not be allowed at the border district. Any district that is along the border will not be allowed to use public and private transport.
Okay.
And the reason is that we still have many cases coming out from the other countries. For example, Tanzania and South Sudan are the biggest contributors to our curve of COVID-19.
Okay, so that's COVID-19. We were talking earlier to Bill and getting a brief on addiction. What's happening with COVID-19? Is there a problem of addiction? Is it getting worse from your own experience and from what you have been reporting on NTV Uganda?
Well, we haven't seen so much of addiction because, it has been a new thing for people to stay at home for all this while. And, there's been a lot of creativity posts from, social media. But of course, people with students, people with learners have had to find new ways to continue educating their children in one way or the other. So people who probably like to drink 1 or 2 bottles of alcohol have done that privately. It's not something that has been seen so commonly. Just a few cases of people have been found in bars, of course, in the outskirts of the city and the districts outside of Kampala. Some business like that is still going on. And of course, police, keeps on arresting such people who go to bars, who still continue going to, access places where they can drink from. But I think that's then the addiction that, is available. But we haven't seen a lot of it.
Okay. Walter, stay on the line for a moment. We'll be back shortly. But now, this is some of your comments coming through on a hashtag New Normal. We asked you to tell us if you have a problem with an addiction to alcohol or other things, what you've been doing about it, how it's affecting you. Ustad Sosikadilo says, addicted to alcohol, been pondering about herbal solutions. So that's your answer there for you. M. Nicole, my addiction is shopping for clothes, shoes, and handbags. Na staki kuacha. Okay, we'll ask Susan about that in a moment. This is Eugene Maloba. I'm addicted to my phone like nothing else. How do guys cope without their phones? Okay, good question, Maloba. And this is Anthony Cattell. I'm just addicted to money. Well, many people are. Is it an addiction? Okay, this is Karonga Wawaigwa. I'm struggling to get out of bed. Yes, too much idle time in the house. Carol Omoto, yes, I have a friend struggling with alcoholism. I hope they are tuned in and they're finding our conversations useful. Thank you so much, Carol, for sharing that. We've got Kibet Isaiah. Nice job, Mr. Taib in Mombasa. We wish you well as you keep on looking into the ways of eradicating those harmful drugs to our feeble Kenyans at large. Yeah, I'm sure he's listening to us. Thank you for that comment. And then Mikhail Tafairi Mochama says, I know 60% of Kenyans are struggling with food, and I don't know how they're coping with that because I'm one of them. So people facing hunger, thank you. Tumekupata vizuri. Mejadudi Ann Madhu has a book. Can I buy it? We'll ask her in a moment about her book. Thank you so much for staying tuned in. And Rumeso, most of the young people, you say, have laid off for whatever reason, have been laid off for whatever reason. Nobody really talks about the youth being vulnerable to other vices. Something needs to be done to handle the mental anxiety and the breakdown. Addiction is real. It affects very many people. Asante, Andrew, for that. Now, Now that we move from Tanzania to Uganda, let's go to the other world, more on other parts of the world. Now, stuck in cramped flats and struggling with fears of coronavirus and its economic impact, Russians are turning to alcohol again after a trend of more moderate drinking in recent years. Now, in the first week of self-isolation, alcohol sales rose by 65% compared to the previous month, according to the GfK Market Research Institute. Vasily Shurov, a psychiatrist specialized in addiction, says due to this difficult situation, that is the lockdown, the level of anxiety and phobias in fragile patients is very high. All those who have experienced addiction have started to drink. Drinking alcohol is the only way for them to relax. That's why we have a flurry of calls. So that's the situation in Russia. Now, with South Africa in extended lockdown, a temporary shelter run by a church in the northern suburbs of Pretoria is looking after the country's most vulnerable and drug-addicted homeless. Most of the 89 men at the shelter are getting treatment for heroin addiction for the first time, with methadone administered by Pretoria's community-oriented substance use program, COSUP. Patient numbers for COSUP have roughly doubled since the start of the lockdown, as former street dwellers suffer withdrawal symptoms after being placed in shelters. South African graphic designer Jimmy was expelled from a drug rehabilitation center last month. His exasperated mother refused to let him back into the house. That night, the 25-year-old joined the hundreds of heroin addicts sleeping rough in South Africa's administrative capital, Pretoria. Resigned to squatting in an abandoned building, Jimmy was picked up just 4 days later by policemen enforcing a coronavirus lockdown.
I started methadone because of the lockdown. Drugs wasn't really available on the streets, so I actually volunteered and went to the first shelter I knew of. It was Caledonian Stadium in Pretoria Central. It was very overcrowded, but I chose to stay because withdrawals are very painful. I'm actually glad COVID-19 happened because these people show us love, they're affectionate, they care actually. They say they want to plan a reintegration program for us, so I'm waiting to see what's happening.
Because I'm scared of my life. I've got children to go back to, especially now that I'm clean. I want to really get back to them. I've got 3 girls.
So these guys are on the methadone program because they've been injecting themselves with heroin and also Nyaope. Nyaope, it's a drug only in South Africa as a mixture of heroin and efavirenz, a cocktail of many drugs.
That's Pretoria, South Africa. Numerous tributes have been given to doctors and frontline workers across the world, from individual tributes, online messages, hospital performances, to government-sanctioned tributes such as military flybys in the USA. But the frontline workers are tired of these and they want real action, not thank yous.
I'm Dr. Bill. I'm as patriotic as the next guy, but I read today they're going to have the Blue Angels and the other Air Force flying wizards fly over many cities for the healthcare workers to show their support. It costs $450,000 per flight over a city. So if there's 2 of them, that's 900 grand. You want to help healthcare workers? These are the goddamn N95 masks that we have to deal with. These are painters' masks. Get us equipment, get us PPEs, get us N95 masks that are worth anything. Get us tests for everybody. Okay? Don't fly over something so we can see some crap for $450,000 to make the president look good. You want to help healthcare workers? Take that same money and feed the people in the inner city that don't have anything to eat. Help the food care workers who are working. Help the service industry people. Don't fly over and say, oh, aren't they great? Come on, let's get real.
Wow, talk about shooting straight from the hip. Now, Bill, let me come back to you. We were running that report from Russia. Drinking is on the rise. You know that society very well. Are you surprised?
No, why would I? I wouldn't be surprised anywhere, but Russia, Ukraine, the former Soviet Union, they are very social people, as opposed to what I was exposed to growing up, which were the movies, you know, of the bad guys, the Russians. They don't smile. They are very, very, very social people. They spend a lot of time together, interacting together. So basically, you find that they are always together. They definitely would they would have a problem concerning, you know, social distancing and all that. Unfortunately, I was not able to hear if there was a lot of feedback.
Sure.
In the
Okay, well, let me bring it closer home to, so what kind of help is available for people suffering addiction in Uganda right now?
Right now, the help that is available is direct communication. I have people, the people that know me, the people that find me on my social media pages, those that are referred, they usually call me. If they are reachable, I ride my bicycle and get to work. Unfortunately, I was not considered an essential worker to be given a sticker so they can be able to drive to longer distances. But that notwithstanding, we have different people in different areas. Fortunately, we have many rehabilitation centers and professionals working in different parts of the town. So if someone is in a long distance away from the place I am, I will contact somebody who is in that area, and they will meet and have a chat and see what to do. Interventions are still going on. People are still being brought into treatment. But like I said, at Safe Places Uganda, we will let you in when you've gone through the COVID test, you know, and the quarantine as well. We haven't yet gotten someone with a problem, we tested positive, but I mean, something would need to be done. Okay. The challenge, yes?
Yes, you can.
The challenge is people accepting to get the help, people accepting to communicate, because they believe, no, we can handle it on our own. Also, they don't want to spend money dealing with that problem when they're already spending money on a person who has got a problem. That is if it's a family. And the addict or the person who is suffering an addiction shies away from the problem because they are trying to maintain a way through manipulation in which they can continue using their drug of choice as much as they possibly can. Okay,
Bill, thank you for that. Yeah. Let me cross over to Mombasa to Taib. What sort of challenges are you facing in providing help to those who need help, to addicts who need help?
Here, and now we are seeing the challenges in terms of getting addiction treatment. One is to be able to have to follow the Ministries of Health guidelines in terms of social distancing. So the assessment, the clinical processes, the tests, these are the things that we cannot do because of the guidelines that has been given. Also to have people into the inpatient program, like our colleague in Uganda has mentioned. You need to go through the test, you need to have the quarantine process of 14 days, then we can be able to take you through the inpatient program. We have seen the challenges of methadone because of restriction of people being assessed, and there are people who are willing to go into the program, but we cannot be able to enroll them into program because the restriction is there in terms of social distancing, the people to be assessed. And we have seen the lack of support for key population or people who use drugs. At least we are thankful here in Mombasa. The Governor Hassan Ali Joho has been very supportive, our Member of Parliament MP, because they lack, they live hand to mouth. They want to use their money to buy a heroin, to buy drugs. They cannot afford to buy a meal. They cannot be able to get a place to eat. And the hotels have been closed. This is where they get meals. This is where they support, they get their casual work, and they don't have any income that is coming in. So this is the challenge scenario within ourselves. And unlike in Uganda, here in Mombasa, we have permission to walk around to be able to reach out to them because they need to get the essential. Like we are doing the needle and syringe program under the government guidelines, and they need to get a clean needle every time they inject. So we make sure that these services reach out to them, the condoms reach out to them, because as much as we are told to stay at home, we need to be safe in terms of HIV prevention and also the gathering within the areas dens.
So Taiban, just briefly, and I'm assuming it's also been a difficult Ramadan, even for yourselves and for the addicts as well.
Very. Yeah, even for us as people who work, it has been very difficult because our norms of going to prayers to have the Tarawih prayer has been not done in this Ramadan or this year because of the restriction of health conditions that we have been told, and we have guidelines in terms of how we need to lead our prayers at home. And now going to the people who use drugs because they live in the dens, they want to come out of drugs during Ramadan. We have seen a lot of the influx of people who want to come into programs, but we cannot be powerless in terms of helping them because people want to go into treatment centers. There are guidelines that needs to be followed. The expenses of having those tests and also staying in quarantine for 14 days and now going into the program. And also we would like to decentralize. We are lucky here in Mombasa because we have the restriction in movement in our old town drop-in center, but through the county commissioner, the government here, the county level, they've allowed us, and with the partnership of county government, with the Department of Health, with our organization Reach Out, we have seen a lot of support now. We have decentralized the methadone within our drop-in center. So we are very humbled by support of Kenya Red Cross, who have been supporting us with the wellness van to be able to penetrate the street of Old Town where the restriction of movement have been done to be able to provide this essential service.
Taib, shukran. Let me just turn to my guest here in the studio, Susan. Actually, I want to take you a step back to sex addiction, because I know that's an area that you also handle. Now, in addition to what we heard earlier from Julie, I know you also talk about other causes or things that spark this addiction. Can you, sex addiction that is, can you just tell us a little bit about that?
Okay, working with my clients, we have noted that most of them have what we call impulsivity. So they're not able to control their impulses. And the issue of being exposed to, let's say, bodies very young, I would want to put it this way. Most women dress in front of their children as young as 3, 4, 5, and they are boys, and they don't think much about it. But this affects this child, that later on in life they become sexualized, and they want to understand, why did I feel this way when I saw mom naked? The other thing we have noticed with this COVID-19, the issue of isolation, and people are closed in the house. So people are looking for pleasure in every way, whether it's alcohol, whether it's pornography, whether it's sex. So I'm hearing a lot of incest happening, whereby this person is having sex with now minors or even becoming pedophiles because they are addicted to sex and now they are controlled. They can't go out there to get it how they were getting it. So it's becoming very risky. The issue of STDs, as far as sex addiction is concerned, 68% of people who have sex addiction tend to have sexually transmitted diseases, including HIV/AIDS. So we are realizing sex addiction in itself, it's becoming worse because of the isolation, the closed down. You can't be able to do what you have been doing before. You're still not aware that this is a disease. Like the way the person is writing there, I shop, I don't think it's a disease. We are calling these process addictions. And there are many, including gambling, shopping, food, the other process addictions that are out there. But
so when you have someone who has a sex addiction, trapped in those kind of circumstances, spending long hours at home,
yes,
what help is there? What should they do to reduce these instances of domestic abuse?
They need to look for a professional to help them deal with the anxiety and depression, because they must be processing a lot of other things that are unknown to the normal person who is with them there. So reaching out for that help is very, very important. Unfortunately, it's a taboo for us, especially in Kenya, to talk about sex or sex addiction or even pornography or masturbation. And you realize all these are sex addictions. So they come in many forms. Sex addiction can be pornography, it can be masturbation, it can be to exhibit yourself, it can be prostitution. So it comes in many forms as a sex addiction. So the young people are really, really affected because of the phones. I like the way our friend from Uganda is saying, they're having internet, they're having phones. So this is where they're accessing early sex.
Very easy access.
Very easy things that they're not supposed to be seeing.
Okay, let me come to Anne Madhu. You've had this very long journey. You're now a recovery coach. Can I first of all give you 10 seconds to, someone asked you about your book. What is it called in just 10 seconds? And then I move on to something else from you.
Okay, here I have it. So, but again, I don't know whether they can see it.
We can see it. In summary, in two sentences,
Yeah,
what is the book about?
My journey in alcoholism and how I got help. It's available in all the lead bookshops in the country. If you're in Nairobi, you can get it at Savani's Bookshop, Accra Road. Textbook Center, Kijabi Street, and also Prestige Bookshop,
Okay,
Mama Street.
That's your 10 seconds of a free commercial. Now let's come back to the to the serious business. There are people watching this,
yes,
who are struggling with issues that you have dealt with and you have, helped other people to deal with. What is your advice to those watching this at the moment who are suffering from alcohol abuse?
What I can tell them is that recovery is possible. They should not shy away from treatment. Like I said earlier, addiction is shame-based, and the biggest problem now is breaking the denial, because the addict is in denial, the family is in denial, the community is in denial, and as a nation we are in denial. Because addiction has been there, it is there with us, and it's killing a lot of people. It's only that it's never highlighted. When someone dies, we don't say this one died from alcoholism or drug addiction. So they should reach out to us. I'm on Facebook. They can try as much as, and I believe you'll share our numbers. They can reach out to us, and then we can see how we can do an intervention, because actually recovery starts with the first contact. Even now talking to them, it just gives them hope, because the main purpose here is hope. If that person has no hope, you can't help them.
Okay.
But with hope, recovery is possible.
So, and 15 years and counting, you are sober. What has kept you going, briefly?
What has kept me going is I wanted to rebuild my life. I wanted to reconnect with myself, with my family, with my children, and with God. Because I had a spiritual void, and that's why many times I went to crusades. I got born again in the morning, I forgot, and went back to the Changa dance. So at least now I have a church that I go to, and I work with the church very closely, especially with the youth through my bishop, Julius Tuinkoi. We've been able to reach out to a lot of youth in Kajiado. Oh. So that's what I've been doing basically before the COVID, and I believe we'll continue doing the same.
Okay, Bill, I'm coming to you with the same question. What keeps you going on your journey?
What keeps me going is majorly where I came from. I mean, when you were talking, when I was watching that part about sanitizers, I remember that at my lowest in the Ukraine, we used to be adults were given free aftershave. It was called Adikalon, so I used to drink that sometimes. We also, with a couple of friends of mine that were addicted, we used to drink surgical spirit. We just knew how to mix it with water and things of that nature. So with aftershave, the only thing you'd get a lot of is nausea, but the height was the same. So it was terrible, and I don't want to go back to that. I remember how I almost lost my family. I mean, I couldn't connect with my relatives, with my friends. My mom couldn't tolerate me because I had gone beyond, and she was like the kindest human being you could ever think of. Thinking about what goes beyond the pleasure of the moment keeps me going strong.
So in a sentence,
basically.
Bill, to an addict watching us from alcohol, your words to them?
Yes, my words are get help. Addiction is progressive. If you don't deal with it now, you'll have to deal with it later. When you deal with it later, it will be more complex and more difficult to get out of. So get help, get help, get help. Come to Safe Places if you're in Uganda. Check for us on Facebook. Safe Places Uganda Treatment Center. You can get our contacts. Call, let us talk. Let us see how we can direct you and show you, the best way forward. Also, if there is a group near you, or somebody who has been through it, please talk to them, but start by talking to someone. And for those who have gadgets, these gadgets, I'm using my phone, use this gadget to get as much information wherever you are as possible, if it is to help you yourself or if it is to help your family member.
Okay. Bill,
Yes.
in Kampala, thank you very much indeed for joining us this morning for this discussion on COVID-19 and addiction. And to you, Taib, as well in Mombasa, thank you very much. Shukran for that, as well as Susan with me in the studio, Susan Guitar. Thank you very much for joining us. Anne, it's been a pleasure speaking to you and for you to sharing your journey. Good luck with everything there and for people that you're reaching out for. Thank you to all my guests who also joined us much earlier. Now, did you know that addiction is not a weakness? Addictions are a form of illness. Many people still think of addiction as meaning a lack of personal strength. An addict has almost no control over their actions. In a sense, they're as much a victim of their disease as a person suffering from diabetes or heart problems. Did you know that addiction is a lonely disease, as we've been discussing here? Many addicts are in denial, and many deceive those they love about the extent of their illness. This can make them feel isolated and cause their addiction to get worse. Did you know that behavioral addictions begin the same way that drug or alcohol addictions do? Well, neurotransmitters and other natural chemicals will flood the brain whenever an addiction-prone or an individual that has an affinity to addiction engages in these activities. And while it's true that behavioral addictions don't cause a physical dependence, people with a behavioral addiction will experience similar adverse consequences.